NBC's Vaughn Hilliard is live for us in Lenexa, Kansas. Also with us is Dr. Uche Blackstock, the founder and CEO of Advancing Health Equity. She is also a Yahoo News medical contributor. And Vaughn, I'll start with you there on the ground in Kansas. You're at this distribution center where they are preparing to send vaccine doses to long-term care facilities. It would seem as if you're in the parking lot of a CVS there. What are you seeing?
Exactly. This is more than a CVS store for your pack of gum and laundry detergent today, Craig. This is the place where we have seen pharmacists head out those front doors and load up their own pickup trucks to head out to these long-term care facilities. Because here, in Lenexa, Kansas is just one of 36 states, as well as Washington, D.C., that is today sending out vaccinations to long-term care facilities. You saw some initial states, sort of the first ones out of the gate to roll it out last week. But today is the big day in America when 36 states are beginning this process. And we have watched these pharmacists leave these doors here to head out to these facilities to inject those residents with their first doses of the Pfizer vaccine here in Kansas. I want to let you hear part of my conversation with the district leader here for CVS in town.
We're across the entire country, so we're able to really facilitate the distribution of the vaccine across the entire country. We have about 1,100 depot sites across the country. We got 15 to 20 in the Kansas City metro area. And what we're doing with that vaccine is it's coming into the store, and then that's where the pharmacist is going to get it to take it on site. And the depot sites are strategically located so that we can cover the geographic area where the senior living facilities are and where the need for the vaccine is.
As you heard Nate lay out there, it's more than a store. This is one of those 1,100 depots around the country. And I was talking with an aide to the governor here in Kansas just last night who said it's imperative that Walgreens and CVS are part of this because they have that reach, particularly out into more of these rural communities in places like Western Kansas, where they're able to go and ultimately administer these vaccinations out to places that are a little bit less populated, Craig.
For those of us who have loved ones in a long-term care facility, it is good to see that they are finally starting to get the first dose of that vaccine. Vaughn Hilliard there for us in Kansas. Vaughn, thank you so much for that. Dr. Blackstock, I turn to you now. The FDA, as you know, gave that emergency use authorization for the first vaccine 17 days ago. Vaughn just showed us how it's starting to reach communities across the country. How long do you surmise it's going to take for a vaccine to become widely available to anyone who wants it, folks like me and you? Well, I guess not so much you, folks like me.
Yeah, actually, I'll be getting my vaccine later this week because I am a frontline healthcare worker. But, there are going to be several prioritization groups. We're still in the 1A group. There's going to be the 1B group, which is the group of essential workers and people over 74, and then the 1C group, and then several other groups before we get to the general public. So I think optimistically, we're looking at the summer, June, July, hopefully by August, that the vaccine will be available to the general public or anyone who wants the vaccine.
Do you agree with the sentiment that we heard from Dr. Fauci a few moments ago that the darkest days are probably still ahead of us?
Yeah, no, I absolutely agree. I'm concerned because I know that air travel, car travel has been at its highest since the pandemic began because of the holiday season. In order to get this virus under control, we also need individuals to play a role. So it's not just up to state, local, federal leaders to put restrictions in place and testing, but we also need individuals to make responsible choices. And I know people are tired. They want to be with their family members. But what we're going to see with this traveling is we're going to see another exponential surge and probably the worst numbers that we've ever seen in this pandemic.
Before we let you go, I want to talk about this op-ed that you wrote for the Washington Post. I read it. I would encourage our viewers and listeners on Sirius Satellite Radio to read it as well. And you essentially asked America to say Dr. Susan Moore's name. For those unfamiliar with her story, Dr. Moore was a Black woman. She was a family physician, and she died from COVID-19. Before she did, though, she said to her white doctor, made her feel like a drug addict, refusing to prescribe additional narcotics when she complained of pain. She said he said that the doctor didn't listen to her lungs, suggested she should go home. You wrote, quote, "No matter how well-intentioned our healthcare system is, it has not rooted out the false idea of a hierarchy of human valuation based on skin color, and the falser idea that if there were such a hierarchy, white people would be at the top." Dr. Blackstock, if a physician can't get the care that they feel like they need, if a physician can't, where are we?
Right. And that's why myself and my three physician colleagues who are also Black women felt the need to write this piece to humanize Dr. Susan Moore, but also to bring to the forefront that, education doesn't protect Black people. We still see these same patterns of negligence, of ignorance of our needs in healthcare settings, regardless of our socioeconomic status and regardless of our educational background. So in this op-ed, we are calling on healthcare systems and institutions to be held accountable, to look at their policies and practices, to be explicit about practicing anti-racism. And that's the only way we're going to prevent from what happened to Dr. Moore happening again. This needs to stop. And Dr. Moore could have been our sister, she could have been our mother, our friend, she could have been us. And so that's why we wrote this piece on her behalf.
Dr. Blackstock, stay with us. We're going to come back to you in just a few moments.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.